What's up guys, this is part 2 of my most recent video that I made going over how to prepare for COMLEX, kind of my experience, my recommendations on resources. But in today's video, we're going to be talking about all the high yield concepts that are probably going to show up on your COMLEX, and these are things that you just need to know in order to do well. So the first thing that you guys need to have memorized are the Chapman's points. Now there's a really good resource that I mentioned in my most previous video, and it's called Dirty Medicine. It's a YouTube channel. He has a playlist specifically on the OMM section of COMLEX, and in that series he does a video on Chapman's points. And basically you guys just need to know the anterior Chapman's points. That being said, there are some high yield posterior Chapman's points. Specifically around the pelvis and sacrum area, you need to know the posterior Chapman's point for the appendix, and you need to know the posterior Chapman's points for the ribs, kind of just as a whole. But if you guys don't want to memorize a bunch of Chapman's points, definitely learn the high yield anterior points and then know the posterior one for the appendix and for the lumbar region. That being said, you're going to get a lot of questions regarding the anterior lumbar Chapman's points. So those are the ones that are around your AIIS. You need to know those. You need to know how to treat those with Counterstrain. That is a huge thing. And I'm going to be talking about that pretty soon in this video. You also need to know kind of the weird anterior Chapman's points, like for the prostate, which would be located on the outer thigh. The other important Chapman's points are the ones that have to deal with the upper body, so like the head and neck. There's some really weird ones that deal with the sinuses. The eyes, I believe, are on the humerus, which is really weird. The sinuses, the middle ear. Just know the Chapman's points that are around the clavicle and first rib, because those can get really confusing. And all it takes is to make a few flashcards on those to really nail those down. The next thing you guys are going to really want to hammer down is Counterstrain. Like, what are the steps to Counterstrain? How are you going to treat certain tender points? Because they love asking questions about treatment with Counterstrain. That's going to be the highest yield type of treatment that you're going to see on your COMLEX. They don't really go too much into like HVLA and soft tissue and other types of treatment. They really like Counterstrain because there are so many tender points. There's so many Chapman's points that you can treat. One of the highest yield ones is the piriformis. So know how to treat the piriformis with Counterstrain. And then the other high yield tender points that they are going to want you to treat with Counterstrain are the ribs. So inhalation and exhalation, somatic dysfunctions, they're going to want you to know which muscle groups you're going to use to treat a rib dysfunction. They're going to want you to know how to set up those types of Counterstrains. They're going to want to know the activating force. So those are very high yield Counterstrain treatments that you guys definitely should know. The other really high yield Counterstrain treatment you're going to want to know are the anterior lumbar tender points. So I talked about those with the Chapman's points. It's essentially the same thing. It's the same points. You're going to want to know how to set up those treatments. So are you flexing at the hips? Are you side bending towards or away? So those types of things you're going to want to know. So the next really high yield topic is radial head somatic dysfunctions and treatments. So you need to know about pronation and supination, and if that puts the radial head into an anterior or posterior position, because that can be very confusing. And then that also has to do with muscle energy treatment. So for the radial head, they're most likely going to go for a muscle energy treatment. So you're going to need to know the activating force. So is the patient going to be actively pronating against your resistance or supinating? The other thing you're going to want to know for radial head dysfunctions is the HVLA treatment, because the treatment for an anterior versus a posterior radial head is very, very different, and they love going after those differences. The next really high yield topic is the fibular head somatic dysfunction, whether it's an anterior or posterior fibular head. You need to know that. You need to know how the foot will be restricted in those dysfunctions. So is the foot going to be able to dorsiflex versus plantar flex? What does it mean to have a pronated foot versus a supinated foot corresponding to an anterior versus a posterior fibular head? So there's a lot to go on with the fibular head. They also want you to know about how the talus is going to be affected based on one of those somatic dysfunctions. Just know that the talus is always going to move opposite of the fibular head. So hopefully that will get you a couple free points on your COMLEX. Now, as far as treatments for fibular head somatic dysfunction, they're going to most likely go after muscle energy. They could go after Counterstrain and HVLA. So it might be good to know those ones as well, but I would for sure know muscle energy. All right, so another really high yield point that you will for sure see on your COMLEX are these definition type of terms, viscerosomatic, somatic visceral, visceral visceral, and somatic somatic. I think those are the four. Basically, what they're gonna get after is, for example, a visceral somatic injury. So what that means is something inside of your body is causing a more external manifestation. So like if you have something wrong with your stomach, then you're gonna have like a backache because of tight paraspinal muscles. So the stomach is within your body and it's causing those paraspinal muscles to spasm, and that's the somatic part. So the viscera is affecting the somatic region. So visceral somatic. Hopefully that quick example will help you guys kind of figure out the rest of them. The next high yield point are your visceral somatics or your dermatomes. So you need to know your dermatomes. You need to know specifically your lower extremity ones are very high yield because the lower extremity as well as the upper extremity, they kind of do this twisting motion. So for example, your L4 dermatome starts on the lateral side of your thigh, it crosses the knee and then goes to the medial side of the lower leg, which can be a little confusing for people, but those are the types of things that they are going to expect you guys to know on COMLEX. Some other really high yield dermatomes are the nipple region, which is T4, as well as the belly button, which is T10. And then the other thing they're going to test you on is sensation. So at least for the hand, like the thumb is C6 because it makes kind of like a 6. And then for the foot, you got your big toe, which is L5 because that's the biggest L you have. And then your pinky toe is S1 because it's little. So those are also types of things that they're going to expect you guys to know and show up very frequently on COMLEX. Now, many of you guys may be asking, is the cranial stuff very high yield on COMLEX? The only things that I have seen come up and from talking to other people is treatment for babies that have difficulty feeding, and it's going to want you to know where you're supposed to treat that baby, which I believe is around the foramen magnum, so kind of like the suboccipital release technique, but as a cranial technique. I can't remember kind of what it's called, but honestly, if you guys check out the question bank that I went over in my previous video, you can find the link down in the description. But I went over a question bank called TrueLearn, which is really great for studying OMM for these board exams. You can type in like cranial treatments and it'll come up with only questions based on cranial treatments. And that would probably be the best way of going about studying these treatments and finding those high yield points. But I would for sure know how to treat an infant that has difficulty feeding through a cranial technique because that's probably what they're going to ask. All right, guys, if you're still here, we're getting through this. I know it's a lot, but these are definitely high yield points and they're going to help you guys do very well on your COMLEX. The next high yield point is diagnosing innominate somatic dysfunctions. For the most part, you're just going to have to do a diagnosis. So they're going to want to know if it's anteriorly rotated, posterior. I think they like going after shears, so a superior innominate shear. And you can basically know if it's a shear if the pubis is elevated or depressed. So that's pretty much the way you know if it's a shear. But definitely know your innominates and know how to treat an anterior or a posterior innominate with muscle energy. That is very high yield as well. The next very, very, very high yield topic is diagnosing a sacral somatic dysfunction and how to treat it, but they mainly want to know if you can diagnose it properly. So you definitely need to know how to diagnose a sacral somatic dysfunction, and you also need to know how it's going to affect L5. So L5 and the sacrum always rotate in opposite directions. So hopefully that will help you. Like I said, guys, there's a really good video that the YouTube channel Dirty Medicine made on diagnosing sacral somatic dysfunctions as well as Innominates. So definitely go watch those videos because you will 100% have at least one, maybe 2 or 3 or even 4 questions on the sacrum itself. All right, so the last thing I want to talk about in this video, and it is how the sternocleidomastoid muscle affects movement of the neck. That can be very confusing because if I remember correctly, it's the opposite sternocleidomastoid that contracts to move your head in the opposite direction. So it is very confusing. They will go after how to treat that with muscle energy. So definitely brush up on the mechanics of the SCM and how the patient is going to contract against your force in order to treat it with muscle energy. You will have a question on that. It's very high yield. And guys, honestly, this whole video was extremely high yield, stuff that I didn't cover. So like BLT, just know the steps of BLT, FPR, stills technique. You need to know kind of just how to set those things up. That's pretty much all there is to those techniques. But yeah, if you guys have any additional questions, feel free to reach out to me on my Facebook page. It's called MedBoards Prep. If you guys already took COMLEX and want to help out future med students that are preparing for COMLEX, drop comments down below of high yield topics that you guys have seen, because these exams are hard enough, and if we could have some sort of idea of what to prepare for, we're all going to be much better off and more successful. So yeah, I hope this video was helpful, you guys. If it was, give it a like, subscribe to my channel, and I hope to see you guys in another one of my videos.